Passing ACLS exam updated for 2026 proven tips to pass certification fast. Question 1. A 62-year-old man has mild swelling, a palpable thrill, and a continuous murmur in his right groin 1 week after undergoing a percutaneous coronary intervention via right femoral access. Which of the following is the most likely cause of these findings? Option A. Abnormal arteriovenous communication. Option B. Femoral artery pseudoaneurysm. Option C. Localized hematoma expansion. Option D. Deep vein thrombosis. The correct answer is option A. Abnormal arteriovenous communication. Inadequate hemostasis after a femoral puncture can lead to bleeding that tracks into an adjacent venous puncture site, creating an arteriovenous fistula. This typically presents with mild swelling, a palpable thrill, and a continuous bruit throughout the cardiac cycle. Question 2. A 68-year-old woman with a history of hypertension and diabetes mellitus presents with palpitations and is diagnosed with a transient episode of atrial fibrillation. Her renal function is normal. According to stroke risk guidelines, which of the following is the best pharmacologic treatment? Option A. Direct oral anticoagulants. Option B. Daily low-dose aspirin. Option C. Dual antiplatelet therapy. Option D. No pharmacologic therapy is indicated. The correct answer is option A. Direct oral anticoagulants. Based on the CHA2DS2VASC scoring system, a patient with a score of 2 or more has a high risk of thromboembolism and requires chronic anticoagulation. Direct oral anticoagulants, such as rivaroxaban or apixaban, are preferred over antiplatelet therapy. Question 3. A 62-year-old man is being evaluated for shortness of breath when he suddenly becomes unresponsive. He has no palpable pulses, but the cardiac monitor continues to show a narrow complex tachycardia. Which of the following is the most appropriate next step in management? Option A. Initiate immediate chest compressions. Option B. Perform synchronized cardioversion. Option C. Administer a synchronized defibrillation shock. Option D. Intubate the patient immediately. The correct answer is option A. Initiate immediate chest compressions. The patient is in cardiac arrest with pulseless electrical activity, defined by an organized rhythm on the monitor without a palpable pulse. Because the rhythm is organized, defibrillation is ineffective. Immediate cardiopulmonary resuscitation with chest compressions is required. Question 4. A 39-year-old man comes to the emergency department due to an episode of dull chest pain that began 2 hours ago. He has a 20-pack-year smoking history and a family history of sudden cardiac death. Electrocardiogram reveals normal sinus rhythm. Which of the following is the best next step in management of this patient? Option A. Obtain troponin levels. Option B. Perform a D-dimer test. Option C. Conduct a treadmill exercise stress test. Option D. Discharge with oral lansoprazole. The correct answer is option A. Obtain troponin levels. The patient's presentation raises reasonable suspicion for acute coronary syndrome. The best next step is to obtain at least 2 troponin levels 3 hours apart. Stress testing should not be performed until acute coronary syndrome has been ruled out. Question 5. A 38-year-old woman comes to the office due to worsening shortness of breath and ankle puffiness. She delivered a healthy child 2 months ago. Blood pressure is 96/60 mm of mercury. A third heart sound is heard at the apex. Which of the following best describes the expected left ventricular changes in this patient? Option A. Increased compliance and reduced ejection fraction. Option B. Decreased compliance and preserved ejection fraction. Option C. Asymmetric septal hypertrophy and dynamic outflow obstruction. Option D. Concentric hypertrophy and impaired diastolic filling. The correct answer is option A. Increased compliance and reduced ejection fraction. This patient likely has peripartum cardiomyopathy, a form of dilated cardiomyopathy. It results in an enlarged, dilated left ventricle with increased compliance and a reduced ejection fraction leading to systolic heart failure. Question 6. A 63-year-old woman has a syncopal episode while driving. 3 days ago, she was prescribed levofloxacin for a urinary tract infection. Her electrocardiogram shows a markedly prolonged QTc interval. Which of the following is the most likely underlying mechanism for her syncope? Option A. Medication-induced ventricular arrhythmia. Option B. Vasovagal reflex bradycardia. Option C. Orthostatic hypotension secondary to dehydration. Option D. Ischemic structural heart damage. The correct answer is option A. Medication-induced ventricular arrhythmia. Fluoroquinolones like levofloxacin can cause acquired long QT syndrome. A prolonged QT interval predisposes patients to polymorphic ventricular tachycardia, such as torsades de pointes, which can lead to transient cerebral hypoperfusion and syncope. Question 7. A 58-year-old woman with depression controlled by a monoamine oxidase inhibitor develops a severe headache, anxiety, and tremors after eating a gourmet meal with smoked meats and wine. Which of the following is the most likely finding on physical examination? Option A, severe hypertension. Option B, diffuse muscle rigidity. Option C, extreme hyperthermia. Option D, diffuse hyperreflexia and clonus. The correct answer is option A, severe hypertension. Foods rich in tyramine, such as smoked meats and aged cheeses, can precipitate a hypertensive crisis in patients taking monoamine oxidase inhibitors. Inhibition of tyramine metabolism leads to massive adrenergic stimulation, presenting with headache and severe hypertension. Question 8. A 65-year-old man with a 45-pack-year smoking history and newly diagnosed diabetes mellitus presents with 4 weeks of constant epigastric pain and significant unintentional weight loss. Which of the following is the best next step in evaluation? Option A, computed tomography scan of the abdomen. Option B, right upper quadrant abdominal ultrasound. Option C, Helicobacter pylori stool antigen testing. Option D, upper gastrointestinal endoscopy. The correct answer is option A, computed tomography scan of the abdomen. The combination of older age, significant weight loss, constant epigastric pain, smoking history, and newly diagnosed diabetes is highly suspicious for pancreatic cancer. A computed tomography scan of the abdomen is the preferred imaging modality for diagnosis and staging. Question 9. A 69-year-old man with hyperlipidemia is prescribed atorvastatin therapy. His baseline laboratory evaluation is unremarkable. He returns for follow-up after 6 weeks and reports good compliance with no symptoms. Which of the following tests should be obtained at this visit? Option A, repeat measurement of low-density lipoprotein cholesterol. Option B, serum thyroid-stimulating hormone level. Option C, aspartate aminotransferase level. Option D, creatinine phosphokinase level. The correct answer is option A, repeat measurement of low-density lipoprotein cholesterol. Following the initiation of statin therapy, patients should have a repeat measurement of low-density lipoprotein cholesterol after 4 to 12 weeks to assess adherence and confirm improvement. Baseline tests for liver and thyroid function are done prior to starting the medication. Question 10. A 45-year-old man in a rural emergency department presents with an acute ST segment elevation myocardial infarction. Because percutaneous coronary intervention cannot be performed in a timely manner, he is treated with a medication that rapidly restores myocardial perfusion. Which of the following drugs was most likely administered? Option A, alteplase. Option B, apixaban. Option C, clopidogrel. Option D, unfractionated heparin. The correct answer is option A, alteplase. Fibrinolytic agents like alteplase are indicated for acute ST segment elevation myocardial infarction when timely percutaneous coronary intervention is unavailable. They actively break down existing fibrin clots. Anticoagulants and antiplatelets prevent new clots but do not lyse existing ones. Question 11. A 28-year-old woman presents with worsening discomfort during intercourse and pressure when sitting. Physical examination reveals a 3 cm, non-tender, fluctuant mass protruding into the vaginal canal located above the right side of the posterior introitus. Which of the following is the most likely diagnosis? Option A, Bartholin gland cyst. Option B, Gartner duct cyst. Option C, Skene gland cyst. Option D, vaginal squamous cell carcinoma. The correct answer is option A, Bartholin gland cyst. A fluctuant, non-tender mass located at the posterior introitus is characteristic of a Bartholin gland cyst. These glands are located bilaterally at the 4 o'clock and 8 o'clock positions of the labia minora and can become obstructed, leading to cyst formation and discomfort. Question 12. A 14-year-old boy experiences fatigue when playing basketball. Physical examination reveals a soft mid-systolic murmur at the left upper sternal border and wide splitting of the second heart sound that does not change with respiration. Which of the following is the most likely cause of these findings? Option A, left to right intracardiac shunting. Option B, dynamic obstruction of the left ventricular outflow tract. Option C, fixed obstruction of the left ventricular outflow tract. Option D, right to left intracardiac shunting. The correct answer is option A, left to right intracardiac shunting. A wide, fixed split-second heart sound and a mid-systolic ejection murmur are classic signs of an atrial septal defect, which causes left-to-right intracardiac shunting. Right-to-left shunting typically presents with cyanosis. Question 13. A 42-year-old woman presents with headaches, vomiting, racing heart, and profuse sweating. She was recently started on propranolol. Her blood pressure is 240/140 millimeters of mercury. Which of the following is the most likely anatomical origin of this patient's condition? Option A, adrenal medulla. Option B, adrenal cortex. Option C, renal parenchyma. Option D, aortic arch. The correct answer is option A, adrenal medulla. The patient's symptoms suggest a pheochromocytoma, a neuroendocrine tumor arising in the adrenal medulla that secretes excess catecholamines. Beta blockers can cause unopposed alpha-adrenergic stimulation in these patients, resulting in severe hypertension. Question 14. A 65-year-old man develops new-onset ptosis and slurred speech following a surgical procedure. Application of an ice pack over his closed eyelids for 2 minutes leads to noticeable improvement of the ptosis. Which of the following is the most likely underlying diagnosis? Option A, myasthenia gravis. Option B, Horner syndrome. Option C, oculomotor nerve palsy. Option D, acute ischemic stroke. The correct answer is option A, myasthenia gravis. The ice pack test supports the diagnosis of myasthenia gravis. The cold temperature inhibits the enzyme acetylcholinesterase, thereby increasing the availability of acetylcholine at the neuromuscular junction and temporarily improving muscle strength and ptosis. Question 15. A 56-year-old man with lung cancer presents with pain, redness, and swelling in his right arm. He received chemotherapy through a right-sided peripherally inserted central catheter 2 weeks ago. Vital signs are normal. Which of the following is the best next step in management? Option A, duplex ultrasound. Option B, computed tomography angiography. Option C, intravenous broad-spectrum antibiotics. Option D, D-dimer blood test. The correct answer is option A, duplex ultrasound. The patient's unilateral arm swelling and erythema in the presence of a central venous catheter strongly suggest an upper extremity deep vein thrombosis. Duplex ultrasound is the non-invasive test of choice for confirmation. Question 16. A 66-year-old obese man with a history of hypertension complains of progressive shortness of breath and a dry cough when lying in bed. Echocardiogram reveals concentric left ventricular hypertrophy and an ejection fraction of 60%. Which of the following is the most likely cause of his symptoms? Option A, left ventricular diastolic dysfunction. Option B, left ventricular systolic dysfunction. Option C, primary pulmonary hypertension. Option D, chronic obstructive pulmonary disease. The correct answer is option A, left ventricular diastolic dysfunction. The patient's presentation of exertional dyspnea, orthopnea, and pulmonary edema with an ejection fraction greater than 50% indicates heart failure with preserved ejection fraction. Prolonged hypertension causes hypertrophy and impaired diastolic filling. Question 17. An 80-year-old woman who recently started a new antihypertensive medication presents with nausea, fatigue, and dizzy spells. Her serum sodium level is critically low at 122 milliequivalents per liter. Which of the following medications is most likely responsible? Option A, hydrochlorothiazide. Option B, amlodipine. Option C, lisinopril. Option D, metoprolol. The correct answer is option A, hydrochlorothiazide. Thiazide diuretics, such as hydrochlorothiazide, frequently cause electrolyte imbalances including hyponatremia and hypokalemia. Elderly patients are at an especially high risk for developing symptomatic thiazide-induced hyponatremia. Question 18. A 28-year-old man is brought to the emergency department after a seizure. He recently completed drug rehabilitation and takes an unknown antidepressant. Examination shows sedation, disorientation, flushed skin, dilated pupils, and decreased bowel sounds. Blood pressure is 90/50 millimeters of mercury, and pulse is 130 beats per minute. Electrocardiogram shows sinus tachycardia and AQRS duration of 130 milliseconds. Which of the following is the most likely cause of this patient's symptoms? Option A, tricyclic antidepressant overdose. Option B, serotonin syndrome. Option C, cocaine intoxication. Option D, opioid withdrawal. The correct answer is option A, tricyclic antidepressant overdose. The patient's new onset seizure, anticholinergic toxicity signs like dilated pupils and flushed skin, and QRS interval prolongation greater than 100 milliseconds are classic for a tricyclic antidepressant overdose. Serotonin syndrome would typically present with increased bowel sounds and neuromuscular hyperactivity. Question 19. A 68-year-old woman is brought to the emergency department with confusion, fever, and a productive cough. Blood pressure is 74/46 millimeters of mercury and pulse is 128 beats per minute. Chest radiograph shows a right lower lobe consolidation. Which of the following is the best initial step in management? Option A, intravenous lactate ringer solution. Option B, intravenous norepinephrine infusion. Option C, immediate endotracheal intubation. Option D, oral broad-spectrum antibiotics. The correct answer is option A, intravenous lactate ringer solution. The patient is in septic shock secondary to pneumonia. The most critical initial intervention is rapid fluid resuscitation with intravenous isotonic crystalloids, such as normal saline or lactate ringer solution, to restore intravascular volume and end organ perfusion. Question 20. A 28-year-old woman presents with a sudden onset of palpitations and a pulse of 204 beats per minute. Her electrocardiogram shows a narrow Q or S complex tachycardia with regular rhythm and absent P waves. Which of the following is the primary underlying mechanism of this patient's arrhythmia? Option A, two distinct conduction pathways within the atrioventricular node. Option B, an accessory pathway connecting the atria directly to the ventricles. Option C, increased automaticity of the sinoatrial node. Option D, an ectopic pacemaker focus in the right atrium. The correct answer is option A, two distinct conduction pathways within the atrioventricular node. The patient has atrioventricular nodal reentrant tachycardia, the most common type of paroxysmal supraventricular tachycardia. It is caused by the presence of both a fast and a slow conduction pathway within the atrioventricular node itself, creating a reentrant circuit. Question 21. A 64-year-old diabetic man complains of worsening right calf pain when walking that is occasionally present at rest. Examination shows a small ischemic ulcer at the tip of his right second toe and decreased peripheral pulses. Which of the following is the most likely cause of his symptoms? Option A, arterial atherosclerosis. Option B, diabetic peripheral neuropathy. Option C, deep venous thrombosis. Option D, chronic venous insufficiency. The correct answer is option A, arterial atherosclerosis. The patient's symptoms of intermittent claudication, rest pain, diminished pulses, and a distal toe ulcer are classic for critical limb ischemia due to peripheral artery disease caused by arterial atherosclerosis. Neuropathic ulcers generally appear on the soles of the feet at pressure points. Question 22. A 75-year-old woman is evaluated for frequent episodes of dizziness. In the office, her electrocardiogram shows atrial fibrillation with a rapid ventricular response. On the way to the hospital, she feels dizzy again, and a repeat electrocardiogram shows sinus bradycardia at 55 beats per minute. Which of the following is the most likely diagnosis? Option A, sick sinus syndrome. Option B, third-degree atrioventricular block. Option C, vasovagal syncope. Option D, hyperthyroidism-induced arrhythmia. The correct answer is option A, sick sinus syndrome. Alternating periods of tachyarrhythmias, such as atrial fibrillation, and profound bradycardia in an elderly patient is the hallmark of sick sinus syndrome, also known as tachycardia-bradycardia syndrome. It results from age-related degeneration of the sinoatrial node. Question 23. A healthy 36-year-old pregnant woman at 30 weeks gestation comes to the office for a routine visit. She has trace bilateral pedal edema but physical examination is otherwise unremarkable. Compared to her non-pregnant state, which of the following cardiovascular changes is most expected? Option A, decrease in systemic vascular resistance. Option B, decrease in total blood volume. Option C, decrease in resting cardiac output. Option D, decrease in resting heart rate. The correct answer is option A, decrease in systemic vascular resistance. Normal maternal cardiac adaptation to pregnancy involves a significant decrease in systemic vascular resistance to accommodate increased blood flow. This is accompanied by an increase in blood volume, cardiac output, and heart rate. Question 24. A 55-year-old man with a 30-pack-year smoking history presents with chronic aching pain in his buttocks and thighs when walking. Examination shows diminished bilateral femoral pulses. Which of the following additional clinical features is most likely to be present? Option A, erectile dysfunction. Option B, bilateral lower extremity edema. Option C, resting tremors in the lower extremities. Option D, urinal incontinence. The correct answer is option A, erectile dysfunction. The patient's presentation is consistent with Leriche syndrome, or aortoiliac occlusion. This condition is characterized by the classic triad of bilateral claudication in the buttocks and thighs, absent or diminished femoral pulses, and erectile dysfunction. Question 25. A 64-year-old man with a recent myocardial infarction has a fasting triglyceride level of 465 mg per deciliter. He currently drinks a 6-pack of beer most nights. In addition to starting a high-intensity statin, which of the following provides the greatest benefit in reducing his cardiovascular risk? Option A, reduced alcohol intake. Option B, switching to a carbohydrate-free diet. Option C, adding extended-release niacin. Option D, supplementing with high-dose vitamin E. The correct answer is option A, reduced alcohol intake. Heavy alcohol intake significantly increases serum triglyceride levels. For patients with hypertriglyceridemia, reducing alcohol consumption is a crucial lifestyle intervention that provides substantial benefit in lowering triglycerides and overall cardiovascular risk. Question 26. A 37-year-old woman presents with stabbing upper abdominal pain, nausea, and confusion. Her temperature is 38.9 degrees Celsius, blood pressure is 90/60 millimeters of mercury, and she appears jaundiced. Which of the following is the most likely diagnosis? Option A, acute cholangitis. Option B, acute cholecystitis. Option C, severe acute pancreatitis. Option D, hepatic encephalopathy. The correct answer is option A, acute cholangitis. The patient presents with Reynolds pentad, which includes fever, right upper quadrant pain, jaundice, hypotension, and altered mental status. This constellation of symptoms is the classic presentation for severe acute cholangitis, a life-threatening infection of the biliary tract. Question 27. A 4-year-old boy presents with a 6-day history of high fever, bilateral non-exudative conjunctivitis, fissured lips, cervical lymphadenopathy, and an erythema 2 rash on his hands and feet. Which of the following imaging studies is most critical in the management of this patient? Option A, echocardiogram. Option B, chest radiograph. Option C, computed tomography of the neck. Option D, renal ultrasound. The correct answer is option A, echocardiogram. The patient's symptoms meet the criteria for Kawasaki disease. These patients are at a high risk for developing cardiovascular sequelae, particularly coronary artery aneurysms. An echocardiogram is essential for all patients with suspected Kawasaki disease. Question 28. A 36-year-old man is brought to the hospital following a high-speed motor vehicle collision. He is hemodynamically stable, but a chest radiograph reveals a widened mediastinum. Which of the following is the best next step in management to evaluate for a vascular injury? Option A, computed tomography angiography of the chest. Option B, emergent exploratory thoracotomy. Option C, aortography via femoral artery catheterization. Option D, transthoracic echocardiography. The correct answer is option A, computed tomography angiography of the chest. Rapid deceleration trauma places patients at high risk for blunt thoracic aortic injury. In a hemodynamically stable patient with a widened mediastinum on a chest X-ray, computed tomography angiography of the chest is the diagnostic modality of choice. Question 29. A 38-year-old man comes to the emergency department due to fatigue and progressive exertional dyspnea. He had an upper respiratory tract infection 2 weeks ago. Physical examination reveals basilar crackles, pitting edema, and a third heart sound. This patient is at an increased risk for developing which of the following? Option A, dilated cardiomyopathy. Option B, constrictive pericarditis. Option C, hypertrophic cardiomyopathy. Option D, restrictive cardiomyopathy. The correct answer is option A, dilated cardiomyopathy. This young patient presents with new onset heart failure shortly after a viral upper respiratory tract infection, highly suggestive of viral myocarditis. Myocarditis is a common cause of dilated cardiomyopathy. Question 30. A 42-year-old woman develops sharp, episodic left-sided chest pain after moving furniture. The pain worsens with deep inspiration or trunk movement. Localized tenderness to palpation is present at the left sternal border. Cardiac examination and electrocardiogram are normal. Which of the following is the most likely diagnosis? Option A, costochondritis. Option B, myocardial infarction. Option C, pulmonary embolism. Option D, spontaneous pneumothorax. The correct answer is option A, costochondritis. chest pain that worsens with deep breathing or movement and is reproducible by localized palpation over the sternochondral joints is characteristic of costochondritis. The history of recent strenuous activity and lack of ischemic signs further support this musculoskeletal diagnosis. Question 31. A 63-year-old man with a history of hypertension is completely asymptomatic but is found to have a left ventricular ejection fraction of 35% on a routine echocardiogram. Which of the following is the best pharmacologic management for this patient? Option A. Initiate an angiotensin-converting enzyme inhibitor. Option B. Prescribe a low-dose loop diuretic. Option C. Start oral digoxin therapy. Option D. Reassurance and observation only. The correct answer is option A. Initiate an angiotensin-converting enzyme inhibitor. All patients with asymptomatic left ventricular systolic dysfunction, defined as an ejection fraction of 40% or less, should be treated with an angiotensin-converting enzyme inhibitor and a beta blocker to delay the onset of symptoms and improve long-term mortality. Question 32. A 64-year-old man presents with an acute ST segment elevation myocardial infarction 2 weeks after receiving a bare metal stent for stable angina. Which of the following historical factors is the most likely cause of his current condition? Option A. Medication non-adherence. Option B. Recent recreational drug use. Option C. High-intensity exercise. Option D. High dietary sodium intake. The correct answer is option A. Medication non-adherence. Premature discontinuation or poor adherence to dual antiplatelet therapy, typically aspirin and AP2Y12 receptor blocker, is the most significant risk factor for acute stent thrombosis following percutaneous coronary intervention. Question 33. A 46-year-old man presents with syncope, dyspnea, and weakness. He had a respiratory infection 2 weeks ago. Blood pressure is 90/50 millimeters of mercury. Jugular veins are distended, but lungs are clear to auscultation. Which of the following is the most appropriate treatment for this patient's condition? Option A. Pericardiocentesis. Option B. Intravenous diltiazem. Option C. Oral aspirin and rosuvastatin. Option D. Intravenous propranolol. The correct answer is option A. Pericardiocentesis. The classic triad of hypotension, distended neck veins, and clear lungs points to cardiac tamponade, likely secondary to a viral pericarditis. The definitive and most appropriate immediate treatment is pericardiocentesis to relieve pericardial pressure. Question 34. A 3-year-old boy with a history of extreme fatigue and agitation has episodes of cyanosis that improve when he squats. Cardiac auscultation reveals a harsh systolic ejection murmur at the left sternal border. Which of the following is the most likely diagnosis? Option A. Tetralogy of Fallot. Option B. Atrial septal defect. Option C. Mitral valve stenosis. Option D. Coarctation of the aorta. The correct answer is option A. Tetralogy of Fallot. Tetralogy of Fallot is the most common cyanotic congenital heart defect. Children often learn to squat during hypercyanotic spells to increase systemic vascular resistance, which decreases the right to left shunt across the ventricular septal defect and improves pulmonary oxygenation. Question 35. An electrocardiogram displays normal P waves followed by a progressive lengthening of the PR interval in successive beats until AQRS complex is dropped. Which of the following accurately describes this conduction abnormality? Option A. Mobitz type 1 second-degree atrioventricular block. Option B. First-degree atrioventricular block. Option C. Mobitz type 2 second-degree atrioventricular block. Option D. Third-degree atrioventricular block. The correct answer is option A. Mobitz type 1 second-degree atrioventricular block. Progressive prolongation of the PR interval culminating in a non-conducted P wave and a dropped QRS complex is characteristic of Mobitz type 1 second-degree atrioventricular block, commonly referred to as a Wenckebach block. Question 36. A 65-year-old woman presents to the emergency department with sudden severe shortness of breath and hypotension 3 days after an untreated inferior wall myocardial infarction. Examination reveals basilar crackles and a new soft systolic murmur at the apex. Which of the following is the most likely cause of her rapid deterioration? Option A. Papillary muscle rupture. Option B. Left ventricular free wall rupture. Option C. Interventricular septum rupture. Option D. Acute viral pericarditis. The correct answer is option A. Papillary muscle rupture. Acute mitral regurgitation due to posteromedial papillary muscle rupture is a life-threatening mechanical complication that typically occurs 3 to 5 days after an inferior myocardial infarction. It presents with sudden pulmonary edema, hypotension, and a systolic murmur. Question 37. A 54-year-old man comes to the office for follow-up after being hospitalized for infective endocarditis. He has completed intravenous antibiotics and currently feels well. Echocardiogram shows mild aortic regurgitation. Which of the following is recommended for this patient prior to future dental procedures? Option A, antibiotic prophylaxis. Option B, routine surveillance echocardiography. Option C, low-dose oral aspirin. Option D, warfarin anticoagulation. The correct answer is option A, antibiotic prophylaxis. Patients with a previous history of infective endocarditis are at high risk for recurrence. Current guidelines recommend antibiotic prophylaxis prior to high-risk procedures, such as dental manipulation of gingival tissue, to prevent bacteremia. Question 38. A 46-year-old man comes to the emergency department due to recurrent episodes of chest discomfort that occur mainly during sleep and resolve spontaneously within 15 minutes. He lacks traditional risk factors for coronary artery disease but has a smoking history. Which of the following is the most appropriate long-term preventive treatment? Option A, calcium channel blockers. Option B, non-selective beta blockers. Option C, aspirin and a statin. Option D, spironolactone. The correct answer is option A, calcium channel blockers. The patient has vasospastic angina, caused by intermittent coronary artery vasospasm. Calcium channel blockers like diltiazem or amlodipine are the preferred treatment to dilate coronary arteries and prevent anginal episodes. Non-selective beta blockers can worsen the vasospasm. Question 39. A 35-year-old man with end-stage renal disease misses his dialysis and presents with severe weakness. His electrocardiogram shows peak T waves and widened QRS complexes. Which of the following medications should be administered immediately? Option A, intravenous calcium gluconate. Option B, intravenous regular insulin and glucose. Option C, oral sodium polystyrene sulfonate. Option D, inhaled albuterol. The correct answer is option A, intravenous calcium gluconate. In a patient with severe hyperkalemia and characteristic electrocardiogram changes, the most immediate priority is to stabilize the cardiac myocyte membrane to prevent fatal arrhythmias. This is achieved by administering intravenous calcium gluconate or calcium chloride. Question 40. A 23-year-old man is evaluated for syncope. He reports feeling his heart racing prior to the event. An electrocardiogram obtained during normal sinus rhythm demonstrates findings consistent with Wolff-Parkinson-White syndrome. Which of the following electrocardiogram findings are characteristic of this condition? Select all that apply. Option A, short PR interval. Option B, slurred upstroke of the QRS complex. Option C, QRS interval widening. Option D, prolonged QT interval. Option E, prominent U waves. Option F, ST segment elevation. The correct answers are options A and B and C, short PR interval, slurred upstroke of the QRS complex, QRS interval widening. Wolff-Parkinson-White syndrome is caused by an accessory atrioventricular conduction pathway. Classic electrocardiogram findings during sinus rhythm include a short PR interval, a slurred upstroke of the QRS complex known as a delta wave, and QRS interval widening. Question 41. A 27-year-old woman comes to the office due to daily headaches for the past 3 months. She describes the pain as a constant, dull pressure in her head that worsens at the end of the day. She is able to work through the pain and has no visual changes or nausea. Which of the following is the most likely diagnosis? Option A, tension headache. Option B, migraine headache. Option C, cluster headache. Option D, trigeminal neuralgia. The correct answer is option A, tension headache. A constant, dull pressure that is often bilateral and lacks features such as severe disabling pain, photophobia, nausea, or autonomic symptoms is classic for a tension headache. Unlike migraines, tension headaches typically do not prevent patients from continuing their daily activities. Question 42. A 32-year-old woman complains of intermittent abdominal cramps and alternating episodes of solid stools and watery diarrhea for the past several years. Her pain consistently improves after defecation. She has no fever, weight loss, or gastrointestinal bleeding. Which of the following is the most likely diagnosis? Option A, irritable bowel syndrome. Option B, inflammatory bowel disease. Option C, celiac disease. Option D, microscopic colitis. The correct answer is option A, irritable bowel syndrome. Chronic abdominal pain that is related to defecation and associated with a change in stool frequency or form, in the absence of alarm symptoms like weight loss or bleeding, is the hallmark of irritable bowel syndrome. No further invasive testing is typically required. Question 43. A patient complains of a painful, swollen, and red nodule on the margin of the upper eyelid. Vision is normal and there is no conjunctival injection. Which of the following is the most appropriate initial treatment? Option A, application of warm compresses. Option B, topical antibiotic drops. Option C, immediate incision and drainage. Option D, systemic oral corticosteroids. The correct answer is option A, application of warm compresses. A hordeolum, commonly known as a stye, is a localized infection of a tear gland or eyelash follicle. The condition is typically self-limiting, and the primary conservative treatment is the application of warm compresses to promote drainage. Question 44. A 47-year-old man is brought to the emergency department due to lightheadedness and palpitations. He has a history of a myocardial infarction. Blood pressure is 80 over 40 millimeters of mercury and pulse is 150 beats per minute. Electrocardiogram reveals a wide complex tachycardia. Which of the following is the best next step in management? Option A, synchronized cardioversion. Option B, intravenous procainamide. Option C, intravenous amiodarone. Option D, carotid sinus massage. The correct answer is option A, synchronized cardioversion. The patient is experiencing hemodynamically unstable ventricular tachycardia, evidenced by profound hypotension. The immediate treatment of choice is synchronized cardioversion. Antiarrhythmics like procainamide or amiodarone are reserved for stable patients. Question 45. A 24-year-old pregnant woman at 14 weeks gestation develops left leg swelling and is diagnosed with a deep vein thrombosis via Doppler ultrasound. Her renal function is normal. Which of the following is the most appropriate anticoagulant therapy? Option A, low molecular weight heparin. Option B, oral warfarin. Option C, oral rivaroxaban. Option D, intravenous alteplase. The correct answer is option A, low molecular weight heparin. Low molecular weight heparins, such as enoxaparin, are the preferred anticoagulants for venous thromboembolism during pregnancy. They do not cross the placenta, have a low risk of teratogenicity, and do not require routine laboratory monitoring. Warfarin is contraindicated in pregnancy. Question 46. A 65-year-old man with chronic hypertension comes to the emergency department after a sudden onset of severe, tearing chest pain radiating to his back. His blood pressure is 190 over 110 millimeters of mercury. Chest radiograph shows a widened mediastinum. Which of the following is the most likely diagnosis? Option A, acute aortic dissection. Option B, acute myocardial infarction. Option C, ruptured esophageal varices. Option D, massive pulmonary embolism. The correct answer is option A, acute aortic dissection. Sudden onset of severe, tearing chest or back pain in a patient with uncontrolled hypertension is highly suspicious for an acute aortic dissection. A widened mediastinum on a chest X-ray strongly supports this diagnosis, which requires immediate imaging and intervention. Question 47. A 7-year-old obese boy presents with secondary nocturnal enuresis, daytime inattention, and tonsillar hypertrophy. His blood pressure is elevated. Which of the following underlying conditions is most likely causing his bedwetting? Option A, obstructive sleep apnea. Option B, type 1 diabetes mellitus. Option C, recurrent urinary tract infections. Option D, attention deficit hyperactivity disorder. The correct answer is option A, obstructive sleep apnea. In a child with snoring, tonsillar hypertrophy, daytime behavioral issues, and obesity, secondary nocturnal enuresis is strongly associated with obstructive sleep apnea. The sleep fragmentation interferes with the normal arousal response to a full bladder. Question 48. Which of the following dietary patterns is characterized by a high intake of fruits, vegetables, nuts, and beans, a preference for olive oil, limited red meat, and has been shown to reduce cardiovascular risk? Option A, Mediterranean diet. Option B, low sodium diet. Option C, low carbohydrate diet. Option D, dietary approaches to stop hypertension diet. The correct answer is option A, Mediterranean diet. The Mediterranean diet is advocated for the reduction of cardiovascular risk through high plant intake and olive oil. While a low-sodium diet reduces blood pressure, it has not been proven in randomized trials to reduce cardiovascular events.